Whenever we talk about options of treatment for a knee arthritis patient, we talk about doing exercises, giving medications, giving knee injections, be it PRB, be it new lubricant injection, or a partial knee replacement or a total knee replacement. We wondered, are you thinking that you have to do all of this? Why don't I do a total knee replacement surgery directly and get done with it? If you were also thinking like this video is for you. Hello friends, I'm Dr. Pankaj Walecha and I'm a hip and knee replacement surgeon in New Delhi, India. So people who are in the early phase of arthritis, they should know if they control their weight, if they do proper knee exercises, if they follow proper physical therapy and advice of their doctors, the progression of arthritis into advanced stages gets slowed down. It means if you didn't take care, you may have gone to moderate and then to severe arthritis maybe in 2-3 years or 4 years. I'm using an arbitrary number here just to make you understand. But if you take care of your knee, it may last for 10 years or 15 years. And that's what we are trying to do. We are trying to postpone your total knee replacement surgery, if not completely avoid it, for as long as we can. So the segment of people who require non-operative, non-invasive treatments is absolutely different, and we try to restrict the disease for as long as we can, and we are successful in majority of the patients. There are certain patients who would progress to the advanced stages in spite of our efforts, but we are able to slow it down. Now, patients who require a partial knee replacement surgery, and we were talking about it in one of our videos, where only one compartment is involved. And this surgery has the potential to last for 20 to 25 years. Now, we understand as the longevity of human beings is increasing, we live longer than what we used to. Then the degenerative process or the process of developing arthritis in the knee in a person who is little predisposed to it is higher because we are living longer. So by doing a partial knee replacement surgery, which may last for 20 years or more, we are delaying your total knee replacement surgery. You may require it, you may not require it. Let's say if I do it at the age of 60, you may not require a total knee replacement surgery. But let's say if I'm doing it at 45, then you may require a total knee replacement surgery at the age of 65 or 70. And then mostly conversion of a partial knee replacement to a total knee replacement surgery leads to a quicker recovery as compared to revision of a total knee replacement to a revision knee replacement surgery, which uses bigger implants. If you don't know these implants, then I've done a full video on implants of revision knee replacement surgery. You can go and search on my channel about it. And now if you have come to me at the age of 60, 65, 70 with complete arthritis, then we perform your surgery using the best technology, using the best surgical technique, using the best implant, placing them precisely in your body so that you get the maximum life out of that implant, so that we don't have to do your revision knee replacement surgery. So do you understand? You're not going through all the stages of treatment. It doesn't mean that every patient is going through them because it depends when you came to me. So it doesn't mean if you have early knee arthritis, then I do a total knee replacement surgery for you. If we do that, you're going to be the most unhappy patient roaming around the surface of earth. Because if your knee is not in severe arthritis, knee replacement surgery is not going to help you. Physical therapy, exercises, controlling your weight, taking proper medication is the treatment of choice for you. I hope I could give you some clarity on it, but if you have some questions about it, which you may have, then please let me know in the comment section, and I would love to help you, I would love to guide you. Thank you so much for watching.